I had always had headaches, but they were just headaches. They were easily controlled with a little bit of ibuprofen and I was fine, but then they started changing. They started becoming migraines. As I realized things were off, I noticed when I was giving a report, I would say left when I meant right. And then I would look at coworkers that I've known for, more than 10 years and I'd be like, hey, I can't think of your name right now. So I was forgetting people's names. On January 29th, 2014, went in, had my MRI, and they called me that afternoon and basically told me, you have a brain tumor and you need to come to UF Health and be admitted. When Dr. Tavanapur was giving me my options for this brain tumor, basically he told me, I would have surgery because there is no radiation possibility at this point. Dr. Tavanapur had prepared my parents and said, it's going to be at least 10 hours, 8 to 10 hours at least. And my mom had kept saying, she still says it to this day, that she says, I was not going to be looking for him until it was dark. If I saw him come out before it was dark, she's like, she says, I don't know what I would have done. I remember him telling me it was like 3 o'clock in the morning, and I was like, what? I thought, 18 hours later, I wake up, and I'm like, where'd all this time go? He said I knew what day it was. I thought it was still Monday, but it was now going into Tuesday, and that I knew my parents' names, where I lived, and everything. So apparently everything was still intact. I was cleared by neuropsychology to come back to work, but with some supervision and part-time just for a little bit of time, and then wanted me to follow up with rehab as well. And then the end of July, I actually came back to work at UF Health in the neuro ICU where I was a patient. Going through that really just confirmed that I'm where I need to be. Nursing is what I love, and now having been a patient, I really can relate to my patients. And I've had another nurse practitioner come say, hey, come talk to this young lady and just let her know, kind of let her know that everything's going to be okay, and just try to alleviate any kind of fear.